Health Connect Care Transition Guide, guiding patients safely from hospital to home. A patient comes into the hospital because they have been faced with a health issue that cannot be managed on their own. After 4 days of high-quality patient-centered care, the doctor gives the okay to go home. He quickly gathers his things and goes. Once at home, he suddenly thinks to himself,
In all the excitement, I left without taking the time to understand what I must do next to manage my care going forward.
He feels like he's in the dark and has no one to turn to until he gets a phone call. Hello, Mr. Smith. My name is Connie from Utopia Hospital. This is an automated call chosen for you by your physician, Dr. Anthony, and nursing staff at Utopia Hospital to help your transition of care from the hospital to home. We at Utopia Hospital know how confusing managing your health can be, and we wanted to be sure to provide with all the necessary resources needed to maintain your health so that you can spend more time enjoying your life. Health Connect is an automated telephone transition service that provides patients with disease-specific health education, ensures medications and follow-up appointments are made, and gives the patient the ability to request personal follow-up calls if needed. Currently, most hospitals utilize a live scripted call made by nurses, social workers, or case managers that takes time away from their already demanding schedules. These calls tend to be inconsistent in content, difficult to track for data purposes, and little research proving true efficacy of the process towards reducing readmissions. Sung et al. Noted that a single post-discharge phone call for patients returning home from the hospital failed to produce a meaningful impact on the patient's discharge experience. Through traditional calling, one study conducted by Harrison et al. Found that of 5,848 patients, only 52% received a phone call due to either the hospital staff's lack of time to call or the patient not picking up during the 3 attempts made for follow-up. Health Connect saves the hospital both time and money while providing comprehensive post-discharge care to the patient that, unlike manual calling, ensures that 100% of all able patients receive a discharge phone call by placing 3 calls per day until the patient answers. Implementation is easy. All patients are registered into the system upon admission, and patients are given the option to opt out of the program after the first phone call has completed. Those that choose to stay in the program receive a series of disease-specific follow-up phone calls with beneficial information, as well as a choice to receive alternative means of educational materials through email and/or videos. The data from the calls gets categorized and analyzed in real time in the Health Connect database, in which the participating facilities can easily pull detailed reports by unit to see if there are any patients that require more personal interaction or may be struggling with their discharge follow-up needs. While it appears that there are a few companies attempting automated versions of discharge phone call systems such as Vocera, none worked seamlessly with the hospital's current EMR to pull data for a better, more informative connection with the patient. Health Connect pulls the discharge medication list, discharge follow-up visits, discharge instructions, and diagnoses to create an effective, individualized, comprehensive discharge program for the patient that may run between 6 to 45 calls per patient depending on the complexity of their case. With the average readmissions for heart failure costing $9,923 and hospitals using between 0.5 and 10 full-time employees on discharge phone calls, the small cost of $2 per patient for Health Connect's Care Transition program practically pays for itself. There are no training fees or transition time, and Health Connect provides a step-by-step educational video for staff to watch for a comprehensive understanding of the reporting features. The reports can be set up to automatically fax or email a report each morning for any previous patients on your floor needing a follow-up call, or even at the time of the initial call, so that real-time constructive interaction can take place. The Health Connect system will not require any adjustments in current practice or policies. It simply adds value to the current patient discharge process, as well as helping hospitals achieve Centers for Medicare and Medicaid guidelines. The efficacy of Health Connect will be measured in the reduction of readmissions, the increase in patient satisfaction scores post-discharge, and the financial gains of the institution in regards to full-time employee savings, which will also serve as the marketing points when selling the service. Health Connect gives resources back to the hospital while giving patients the tools and guidance needed to stay home.